The problem we're facing with the increasing number of aging baby boomers needing long term care is something that our society has to deal with. We must implement several measures for our aging baby boomer care crisis to prevent a potentially cascading domino effect on society. Based on my experience in the healthcare industry in the past 30 years, I have outlined some measures that I think would be helpful. Let us discuss them here. Unfortunately, the crisis they foresaw about 20 years ago has arrived, and we cannot avoid it anymore. Our healthcare system still needs to be prepared. The shortage of trained paid caregivers is not helping in our current situation. So, if we rely on solving the shortage issue, it will take years and require much innovation and enormous funding as a solution. But many are already facing this dilemma. Every one of us will eventually be affected, and it will only worsen if we don't take action now, because all baby boomers will turn 65 or older in the year 2030. There are 10,000 baby boomers becoming 65 every single day. That's according to the statistics. The baby boomers have significantly boosted the economy for the past 50 years. They have paid the lion's share of taxes, and some baby boomers are still financially helping their adult children and aging parents. So, with this problem, what are the readily available resources that we can tap into? Well, one thing we'll know that many of us or our boomers may still have relatives, sons, daughters, nieces, nephews, and even adult grandkids who are able bodies and hopefully willing to step up to the plate. After all, they are very important resources that we must look into. How can we tap into them? For one thing, why not provide them with training and support? And those willing to care for their loved ones must be provided with assistance financially by allowing them to work at home while caring for and accompanying their parents and grandparents. Technologies for remote work from home are already available. Matter of fact, during pandemic, it's been widely used and very effectively. Many seniors rely on family members or friends for care, but these family caregivers can often be stretched thin. The government could provide more support for caregivers, such as respite care, financial assistance, and training. Transitioning and creating ways to continue their productivity while working remotely at home is an immense help to solve this problem. So, let me share some measures, steps, and strategies. It's a combination of community based technological advancement, policies, and societal approaches that could hopefully help address the challenges faced by our aging baby boomers who do not qualify for social assistance and also lack sufficient funding, and some may not even have relatives anymore. So, these are a collaboration from public and private partnership to provide the following. We already have Meals on Wheels. It needs to be expanded and provided more funding, entice businesses to participate on Meals on Wheels. Our government should offer tax breaks and other financial incentives, or at least encourage employers to provide to people who care for older adults. Incentives and tax breaks could help to reduce the financial burden on caregivers. They should develop more flexible work arrangements for caregivers, allowing them to balance their work and caregiving responsibilities would entice them to spend time with their relatives or aging baby boomer relative at home. So this tax incentive for employees must also be given to employers, so they will allow their workers or employees who are caring for older adults to be able to continue with their work remotely at home. There should be an established mobile labs and medical services that are easily accessible to every local community where there are a large number of senior adults that needs long-term care. We should promote telemedicine just as we did back during pandemic and provide remote monitoring, use technologies to enable seniors to receive medical care and monitoring from home for wellness and prevention. The government should expand Medicare and Medicaid coverage to include more comprehensive long term care services, reducing the financial burden on older adults. Establish partnerships between healthcare providers and community organizations to coordinate comprehensive care for older adults. Create public private partnerships to develop innovative financing options for long term care, such as insurance or shared risk pools. Public private funded partnership for adult daycare or senior centers would also be needed. We have recreational facilities. They need to develop technology training programs tailored for older adults and help them navigate digital tools, access online resources, and stay connected, providing more social and recreational opportunities for seniors would prevent social isolation, which could become a major problem for seniors, leading to depression and other health problems. The government could provide seniors with more social and recreational opportunities through senior centers, community programs, and volunteer opportunities, again, through funding, partnerships, and tax incentives. There must be a support for development of affordable and accessible senior centers that offers a range of social, recreational, educational activities. Very important. Develop new technologies to help seniors stay independent. Several new technologies can help seniors remain independent, such as fall detectors, medication reminders, and video conferencing. The government could help to develop and promote these technologies and make them more affordable for seniors, for partnerships with private businesses. Expand respite care programs to provide temporary relief for family caregivers, allowing them to take breaks and attend to their needs. This is also very important because they are the direct providers for the care. We need to give them breaks periodically. We must advocate for increased public funding for research and innovation in aging related fields to drive technological advancements and improve the quality of life for older adults. Expand the availability of affordable home care services, including personal care, meal preparation, and housekeeping. Expand access to long term care insurance because long term care insurance can help people pay for the cost of care, such as in a nursing home or assisted living facility. However, it can be expensive and many people do not have the resources to purchase it. The government then could expand access to long term care insurance by providing subsidies or making it more affordable through tax breaks, transportation assistance, and support for developing and expanding affordable senior transportation services, ensuring access to healthcare, social activities, and daily needs. Many seniors have difficulty getting around, making accessing healthcare, groceries, and other essential services difficult. The government could expand access to transportation for seniors by providing subsidies for the public transit or by creating a ride sharing program for seniors. Advocate for policies that incentivize employers to hire older adults and provide workplace accommodations for their needs. That's another thing. To advocate for increased funding and resources for nonprofit organizations and charities supporting older adults. Our churches, the leaders must collaborate with their members, encourage the development of caregiver support groups to provide emotional and practical assistance to those caring for aging individuals, facilitate intergenerational programs that connect older adults with young people for companionship and mutual support. We must provide funding for volunteer groups to assist aging boomers, foster community based care network where neighbors and volunteers support and help older adults. Establish cooperative housing arrangement where seniors can pool resources and live together, sharing costs and responsibilities. Develop affordable and accessible tiny homes with customized structural modifications to make residences for age friendly, reducing the risk of accidents. Because even if the baby boomer or senior adult already has a home, a residence that's paid off, still with their condition, this may not be suitable for them. So it has to be if their home is being remodeled, it would cost more than to just build a tiny one that is safe and comfortable for them. Encourage intergenerational co-housing communities where older adults live alongside families or younger individuals, fostering mutual support. Develop innovative financing models such as equity sharing to help seniors access home equity for living expenses. There must be an immigration reform to make hiring qualified caregivers from overseas. It will be much easier and quicker. Our government should work with other countries to address the aging baby boomer crisis because this is a global issue. The United States could work with other countries to share information and best practices for addressing this issue as well. So, we must prepare for the future because it's not only now, it will be in the coming years. The aging baby boomer crisis is not going away, and that's for sure. The government must start preparing for the future by developing policies and programs to help seniors live long, healthy, and productive lives. We must empower older adults to live their lives to the fullest. Empowering could help them to age with dignity and grace. Never give up hope. The aging baby boomer crisis is a challenge, but it is one that we can overcome. And let us remember the days during pandemic when our senior adults were left alone. As we have learned today, the aging baby boomer population is a growing concern. We need to work together, find ways to care for them, both in the short term and the long term. This means collaborating with each other, sharing ideas, and coming up with new solutions. We also need to support the relatives of aging baby boomers who will be directly affected when the time comes that they need long term care. I challenge everyone watching this video to think about what you can do to help. Can you volunteer at the local nursing home or senior center? Can you donate to a charity that provides care for aging adults? Or can you start A conversation with your friends and family about the challenges of aging and long term care. Every little bit helps. Together, we can make a difference in the lives of aging baby boomers and their families. Here are some specific ideas for how you can help, as an addition to what we have already discussed. Volunteer at a local nursing home or senior center. Donate to a charity that provides care for aging adults. Start a conversation with your friends and family about the challenges of aging and long term care. Advocate for policies that support aging adults and their caregivers. Educate yourself about the different types of long term care available. Make a plan for your own long term care needs. By working together, we can ensure that all aging baby boomers have access to the care they need and deserve. Thank you for your time watching this video, and hopefully, we all learned something from this content. Let's share, and if you don't mind subscribing for more contents in the future. Thank you.